Hi. So lately, I have been having a lot of people come to me with something called pyloric stenosis. Pyloric stenosis is where you have a narrowing of the pylorus muscle. And the pylorus muscle is that muscle that acts as the gatekeeper between the stomach and the intestines. That's specifically the small intestine. Most times, babies that have pyloric stenosis, they develop the symptoms when they're about a few weeks old, and they continue to have these symptoms. Initially, the symptoms are just with some vomiting, and that vomiting starts to get worse and worse, and it becomes what's called projectile vomiting when the baby vomits across the room, and that's typically when parents start to realize, oh, this is not just normal baby speed ups. So, most times when the parents come to me, they have seen their pediatricians multiple times, and the thought process is that, oh, maybe this is just baby speeding up. Sometimes they've changed formulas a few times, and when it doesn't get better, and maybe the baby's starting to get a bit dehydrated, they get sent to the hospital. At that point, we tend to get some blood tests as well as an ultrasound, and the ultrasound is usually pretty accurate in determining the diameter of that muscle, the pylorus muscle, as well as the length. And any diameter over 3 millimeters or length more than 14 millimeters is considered to be abnormal. For that, the management for it is typically surgery. There are some discussion about non-operative or non-surgical means, but currently the standard of care in the United States is a surgery, and the surgery involves splitting the muscle, the pylorus muscle, to allow things to be able to pass through, to allow milk and food and whatever the baby takes in to be able to pass through. This is surgery that is done. It could be done either open or laparoscopically, meaning using the camera or making a slightly bigger cut, and that's dependent on your surgeon. And what we find is typically after the surgery, babies tend to do very well. There are some risks associated, like while cutting the muscle, you might go a little bit too deep, and you might actually get into sort of like the inner lining of the intestinal wall, and that can cause what's called a leak. In which case, the surgeon usually would repair it and might require a longer stay in the hospital. After the baby recovers from this, there might still be a little bit of spitting up, but that tends to be a little bit better, and that sort of goes away over time. So if your baby is throwing up all the time, especially forcefully vomiting, you should probably see your pediatrician or go to the emergency department if there's evidence of dehydration because it might just be pyloric stenosis.